Ladies, enough of beauty tricks and anti-aging tips. Let's talk about something more serious. One wrong step in the bathroom, one slight misstep off the curb, and your entire life can change. But here's the truth. Doctors are finally saying out loud, 99% of balance problems in older women are caused by just 6 avoidable mistakes. If you're over 60 and you've ever felt a little unsteady on your feet, you are not alone. Millions of strong, smart women are silently dealing with declining balance and blaming themselves. But what if I told you it's not just aging, it's not your fault, it's habits, it's medical oversights, and it's lack of real guidance on how to protect your body before the fall happens? I'm here today not to scare you, but to inform and empower you, because every woman deserves to walk with strength, confidence, and independence. In this video, we're breaking down the 6 mistakes most older women are making without even realizing it, and what you can do right now to avoid them. These are insights straight from doctors, physical therapists, and fall prevention experts who work with women just like you every day. So grab a cup of tea, take a seat, and stay with me, because what you learn today could save your independence tomorrow. Before we get into the 6 mistakes that sabotage balance, let's talk about why this happens in the first place. Because the truth is, balance isn't just about staying upright. It's a beautiful, complex coordination of your brain, muscles, joints, vision, inner ear, and even your feet. And yes, time does change the way all of these work. When you were younger, walking across uneven ground or stepping out of the shower barefoot barely made you think twice. That's because your vestibular system deep inside your inner ear was sharp. Your muscles were strong and quick to adjust. Your eyes gave your brain precise information, and your nervous system reacted in milliseconds. But as we age, even the healthiest among us experience gradual changes. The tiny hairs in your inner ear that detect motion begin to weaken. Muscle mass starts to decline, up to 1–2% per year after 50, especially without regular strength training. Joints get stiffer, feet lose sensation, and even your vision changes. It's not your imagination, and it's not weakness. It's biology, and it's normal. So when does normal aging become dangerous? When these small changes pile up and go unnoticed. That moment when you start holding on to walls, when you stop turning your head quickly, when you hesitate to step off a curb. Doctors say these are early red flags. You might think, oh, I'm just being careful, but really your body is telling you, I'm losing trust in my own stability. And that trust, once it starts to go, affects everything. Your posture, your walking pattern, even your confidence to leave the house. And here's the most important thing. Balance doesn't disappear overnight. It slowly fades through inaction, overlooked signs, and lifestyle habits we were never taught to question. Now that you understand the why, let's look at the how. Because what you do next can change everything. Let's start with the most common and possibly the most dangerous mistake older women make when it comes to balance. Sitting too much and moving too little. Many women over 60 tell themselves, I'm just slowing down. I've earned my rest. And while rest is important, being still for most of the day tells your body, I don't need these muscles anymore. And the body listens. According to the National Institutes of Health, adults over 60 who live a sedentary lifestyle can lose up to 8% of their muscle mass per decade, sometimes more. The muscles that support your spine, stabilize your knees, and control your ankles, they weaken. Your core, which acts like your body's internal balance belt, shrinks. Your reflexes slow down. That's why a little stumble that you would have recovered from 10 years ago now sends you to the ground. Doctors and physical therapists call it disuse syndrome. It means that the less you move, the less your body remembers how to move. Your joints stiffen. Your brain-to-muscle connection weakens. And your ability to balance, it fades. But here's the hope. The moment you start moving again, even gently, your body responds. Quickly. You don't need a gym. You don't need expensive equipment. Just 10 minutes of intentional movement a day can retrain your body to support itself again. Start with a short daily walk, inside your home, if needed. Chair yoga or tai chi to improve posture and joint control. Simple body weight exercises like wall push-ups or leg lifts, or even standing on one foot while holding the back of a chair. Every step is a message to your body that you're not giving up. You're rebuilding. You're reconnecting. You're reclaiming your balance. Let's talk about something we often overlook, until it causes real problems. Your feet. The truth is, your feet are the foundation of your balance, and ignoring them is like trying to build a house on crumbling ground. Your feet are filled with over 7,000 nerve endings, 26 bones, and dozens of muscles that constantly communicate with your brain about your position in space. But as we age, things start to change. You might develop loss of sensation in the soles of your feet from diabetes or poor circulation, arthritis in the toes or ankles, or even something as simple but impactful as wearing the wrong shoes. When the nerves in your feet can't accurately tell your brain what's going on down there, your balance suffers without you even realizing why. Many women over 60 deal with foot issues quietly, like bunions, heel pain, or swelling. But these change the way you walk. You might start shifting your weight unevenly, shortening your steps, or walking more slowly, all of which increase your risk of falling. Even calluses or long toenails can subtly alter your step and throw off your center of gravity. Here's what foot experts recommend. Inspect your feet daily, especially if you have diabetes or nerve issues. Invest in proper footwear, a wide toe box, non-slip soles, and good arch support. Ditch slippers without grip and shoes that are too tight or too soft. Do simple foot exercises, toe curls, heel raises, ankle circles. Strong, healthy feet create a confident, stable foundation so your body can focus on moving, not just surviving each step. You might not think what's on your plate has much to do with your balance, but it does. In fact, doctors are warning that poor nutrition and silent vitamin deficiencies are major reasons older women become unsteady. And most of the time, you won't even know it's happening. Your balance depends on a team effort: muscles, bones, nerves, and brain, all of which need fuel. When you're not getting the right nutrients, these systems start to weaken. Muscles need protein, magnesium, and potassium to contract and react properly. Nerves need B12 and omega-3 fatty acids to send fast, accurate signals. Bones rely on calcium and vitamin D to stay strong enough to support you and your brain. It needs consistent glucose from whole foods, not sugar spikes from processed snacks. Even mild deficiencies can lead to muscle fatigue, delayed reflexes, or dizziness, especially in women over 60, whose absorption naturally declines. Here are the top 3 nutrient gaps doctors see in older women that quietly hurt balance. 1. Vitamin D. This sunshine vitamin does more than protect your bones. It supports neuromuscular function, helping your muscles respond quickly to keep you upright. Low levels are strongly linked to falls, and many women don't even know they're deficient. 2. Vitamin B12. Critical for healthy nerves and brain function. Deficiency can lead to numbness in the feet, poor coordination, and even memory issues. B12 absorption decreases with age, especially if you're taking acid blockers. 3. Magnesium. This mineral keeps your muscles and nerves working smoothly. Low magnesium can cause muscle cramps, weakness, and even tremors, all of which destabilize your body. The good news? You don't need to overhaul your entire diet. Just start with a few small shifts. Add leafy greens, salmon, beans, and eggs to your weekly meals. Swap sugary snacks for fruit, yogurt, or nuts. Stay hydrated. Even mild dehydration can make you dizzy. And talk to your doctor about a simple blood test to check for deficiencies. A tailored supplement might be exactly what your balance system needs. Food isn't just fuel. It's prevention. It's healing. It's power. When most people think about staying active, They focus on walking, stretching, or maybe even lifting a few light weights. But there's one essential type of movement that gets left out far too often: balance training. And skipping it may be one of the biggest mistakes older women make. Walking is wonderful. It's great for your heart, your joints, and your mood. But here's what doctors want you to know. Walking alone doesn't challenge or improve your balance system. Balance is a specific skill, just like flexibility or strength. And like any skill, if you don't practice it, it fades. That's why even active older women who walk every day still end up feeling unsteady when they turn quickly, step off a curb, or reach for something overhead. Balance training does more than prevent falls. It teaches your nervous system and muscles to respond quickly, stay coordinated, and stay confident. You're not just standing on one foot, you're retraining your brain to trust your body again. Studies show that older adults who do regular balance exercises can reduce their fall risk by over 30%. Even better, it also improves posture, core strength, and coordination, all of which keep you feeling younger and more capable. You don't need a gym or fancy gear to work on your balance. Here are a few simple moves to try: heel-to-toe walk. Pretend you're walking on a tightrope. Take 10 slow, careful steps with your heel touching the toe of your front foot. Single leg stand, hold the back of a chair, lift one foot off the ground, and balance for 10 to 30 seconds. Switch legs. Over time, try it without holding on. Sit to stand without hands. Rise from a sturdy chair without using your hands. This builds lower body power, key for catching yourself if you trip. Side leg raises. Hold on to a countertop. Gently raise one leg to the side, hold, and return. Great for hip stability. Just 5 to 10 minutes a day can rebuild the reflexes and confidence you thought were gone. Now let's be clear: canes, walkers, and other assistive devices can be life-changing and life-saving when used appropriately. But here's the surprising truth: using them too soon or using them incorrectly can actually make your balance worse. Many older women reach for a cane or walker at the first sign of unsteadiness. It feels safer, and in the short term it might be. But over time, this can become a quiet trap, because the more your body relies on the device, the less your own muscles and nervous system are being challenged. Your core, legs, and postural reflexes weaken from disuse. Your confidence drops, and your fear of falling, it actually increases, which can lead to even more immobility. Before you know it, what was meant to be temporary becomes permanent. So what's the answer? Use assistive devices when they're medically necessary, but always with a clear plan. Here's how to stay in control. Get a professional assessment. Work with a doctor or physical therapist to make sure you actually need the device. Sometimes, a few weeks of balance training or strength work can eliminate the need altogether. Use proper technique. Many people use canes or walkers incorrectly, too high, too low, or favoring one side. This throws off your gait and posture. Always ask for guidance. Make it temporary when possible. If you're recovering from an injury or illness, treat the assistive device like a stepping stone, not a final destination. A cane should be a tool, not a substitute for your own strength and stability. If you've already become dependent on an assistive device, there's still hope. With the right support, many older adults regain enough strength, balance, and coordination to walk more independently. Start rebuilding by doing targeted balance and strength exercises, practicing safe indoor walking without the device under supervision if needed, challenging yourself gradually, step by step, and most importantly, believing in your body's ability to improve. You're not fragile, you're adaptable, and your body can do far more than you think when given the right opportunity. Here's a truth: many older women don't realize until it's too late. Some of the medications prescribed to help you actually increase your risk of losing balance and falling. And the problem is, these side effects can be subtle, sneaky, and easy to overlook. Medications work in your body in complex ways. Some can cause dizziness or lightheadedness, making it hard to stand or walk safely, muscle weakness or fatigue, reducing your ability to react quickly. Confusion or slowed thinking, which can delay your brain's response to a loss of balance. Even vision problems or blurred vision, affecting your ability to see hazards. Older adults often take multiple medications called polypharmacy, and these drugs can interact, amplifying side effects. Here are some types of medications frequently linked to balance problems. Blood pressure medications can cause low blood pressure or dizziness when standing. Sedatives and sleeping pills slow reflexes and impair coordination. Antidepressants and anti-anxiety drugs may cause drowsiness or imbalance. Medications for Parkinson's or epilepsy affect muscle control. Diuretics can cause dehydration and electrolyte imbalances. If you take any of these, or a combination of medications, it's essential to monitor how you feel. Don't stop or change your medications without talking to your healthcare provider, but do bring up any new symptoms like dizziness, fatigue, or unsteadiness. Here's how you can take control. Ask your doctor or pharmacist to review all your medications at least once a year. They can help identify drugs that might be increasing your fall risk. If you notice new balance issues, lightheadedness, or confusion, tell your healthcare team right away. Sometimes, changing the time you take medication or adjusting the dose can reduce side effects. Medications like diuretics can cause dehydration, so drinking enough water and maintaining electrolytes is crucial. Medications are powerful tools, and when managed carefully, they can support your health without stealing your balance. But the key is to stay informed, stay proactive, and never hesitate to ask for help. Remember, balance isn't about avoiding all risks, it's about understanding them and making smart choices every day to keep yourself safe, steady, and strong. You've learned about the 6 most common mistakes that cause balance to slip away, and now it's time to take back control. Because the truth is, balance can be rebuilt, even if you've been unsteady for years. Today, I'm sharing a simple, effective 3-step blueprint that doctors and therapists recommend to help you recover your stability and confidence safely. Step 1 is all about building strength where it matters most. Your legs, hips, and core muscles are the pillars that support your balance. When these muscles are strong, they help you stay steady and recover quickly from stumbles. Try simple exercises like chair squats. Sit and stand slowly, using your legs, not your hands. Bridges. Lying on your back, lift your hips to strengthen your lower back and glutes. Heel raises, stand near a wall, slowly rise onto your toes and lower down. Start with 5 to 10 repetitions of each, 2 or 3 times a week. Over time, you'll notice your legs feel stronger, and your steps more confident. Step 2 is to train your balance like a muscle. Incorporate balance exercises into your daily routine to rewire your brain and body connection. Some easy exercises to try: single leg stands, hold onto a chair if needed, and try to stand on one leg for 10 to 30 seconds. Switch sides. Heel to toe walking. Walk in a straight line, placing your heel directly in front of your toe. Weight shifts. Shift your weight side to side slowly, feeling your feet and muscles engage. These exercises don't take long. Just 5 minutes a day can make a huge difference. The key is consistency. Make it a daily habit, and your balance will improve steadily. Step 3 might surprise you. It's about being mindful of your surroundings and habits. Balance isn't just physical. Your brain needs clear information from your eyes, feet, and inner ear. And your environment plays a huge role in your safety. Here's what you can do today. Clear clutter and rugs that could trip you. Use bright, even lighting in hallways and bathrooms. Wear supportive, well-fitting shoes even indoors. Avoid slippers or socks alone. When moving from sitting to standing, pause and steady yourself before walking. Taking control of your environment and habits reduces risk and gives your brain the confidence to keep you steady. This 3-step blueprint isn't a quick fix, but it's a powerful path forward. By strengthening your body, training your balance daily, and making smart changes at home, you can reclaim your freedom and say goodbye to fear. If you found this helpful, be sure to like this video and subscribe for more tips on aging gracefully and safely. And let me know in the comments, which step will you start today? Because your balance and your life are worth it.